Hi, all. Thank you for joining our referral discovery session. Today, we're going to be digging into the referral system and getting some thoughts and feedback from you all. Natasha Telger is going to be leading this conversation. We just want to thank you for joining us. And if you do have any questions or comments during the session today, please feel free to unmute yourself and ask those or type those into the chat. We will be monitoring that. And again, thank you for joining us and for your participation and thoughts and feedback as we dive into this. Take it away, Natasha.
All right, thank you. So today, I do have this presentation in a mirror board. So let me just go ahead and I can share that link with you in the chat here real quick. There we go. And you're welcome to look at it that way as well. I will be zooming in here in just 1 second. We're going to start out with just a few seconds on the overview. We're going to take a look at the requirements that have been identified from, I know several of you have participated in past sessions where we've looked at different referral pieces, and those are listed on basically this board and incorporated into the different screenshots, mock-ups that we'll take a look at in just a moment. And then as we go through those components and look at the screenshots of the mock-ups, then we'll also be noting some of your other additional, like either must-haves or like-to-haves. So with that, I'm going to go ahead and I'm going to turn off my camera just so that I make sure that you everything is hopefully runs smoothly for you so you can see this. So what we're talking about today is a referral system that would be available through Illinois workNet and allow Illinois workNet partner staff to refer customers to other Illinois workNet partners in a secure environment, and that we can control being able to view different levels of information based on your role and your access levels, and basically like which organizations you're associated with and programs and so forth. So the information is stored in the Illinois workNet system with a customer account. So there's one central place to view referrals, consent forms, referral responses, and then that information will be used to populate dashboards and reports and trigger other like notifications and so forth. So with that, I'm going to jump into the part where we take a look at the requirements that have been identified. And I'm going to zoom in here. So hopefully you can see these key components that have been added. And many of you have already, like I said, been involved with some of the other referral feedback sessions that we've had. And so this is just kind of like the higher level version of that. We've also taken a look at some feedback from different groups that are working with those who are interested in a referral system. And so I've tried to incorporate those into just like looking at the key components to make sure that we're not missing anything or misunderstanding. And I went ahead and bolded some of the areas that keep like kind of like reoccurring themes that keep coming up in these conversations. So I'm just going to go over these little Post-it notes basically, and feel free to jump in and ask any questions. And if I'm missing something, please let me know. We can make a note of that as well. And then once we go through these key components, then we'll take a look at the mock-ups and you'll be able to see kind of how it's laid out. So one of the key components, let me zoom in here a little bit more, is that make sure that the system is available for all partners. So the way this is the plan is to set this up is that any partner that's in the Illinois WorkNet service locator, also called the service finder, can indicate that they are accepting referrals. And one of the things that as they enter the information into the system, we'll be able to have identify the program, but especially whenever some of the groups have identified a standard program description and eligibility requirements, those will already be in the system, so it's easily accessible for any partner to take a look at those descriptions and the eligibility requirements. Partners can identify one or more staff to receive the referral request. So that would be as they're setting up their site, be able to accept and send referrals. The partners would be able to access the referral system through either a direct URL or a link on the partner dashboard within Illinois WorkNet. Once you are logged into your Illinois WorkNet account and you go to the referral module, you'd be able to access the full referral module. You can also respond to referrals, review and respond without logging into Illinois WorkNet. So we have options for, again, just to summarize, available to all partners that are set up in WorkNet and indicate that they're accepting referrals. And you would be able to access it by logging into Illinois WorkNet or also just responding to the referral that is sent to those designated to receive the referral request. Do we have any questions or comments about this first line that's related to who can access the system? Okay, I'm going to keep moving forward, but please feel free to enter any questions that you have into the chat. Another item that came out is the ability to search or add customers on the fly. So when a customer is added to the system, then they would be associated with that organization, or if they, the referral has already been sent, whoever they've been associated with, you would have your list of customers that either you have entered in the system or somebody has sent them to you as a referral. So you'd have the ability to search for customers. If it's the first time that you are working with a customer, you can add the customer into the referral system, and then it would either create an Illinois WorkNet account or it would sync to an existing Illinois WorkNet account on the fly. And it would require the minimal customer information enough to set up an Illinois WorkNet account. And when we say on the fly, what that really means is that you don't need to say, oh, go set up your Illinois WorkNet account and approve it and come back to me, and then we'll send you. It means that I'm going to enter Natasha Telger, and I'm going to enter the information. It's going to check to see if I have an Illinois WorkNet account. If it does, great. I'm going to use that one. And if it doesn't, it'll create it right then and there, and the person doesn't have to go in and verify and that sort of thing. Are there any questions about these requirements or anything else I need to add to this particular?
Okay, I'm going to have lots of questions. I'm sorry. I'm just going to say it right now. Can you, Natasha, define for me what is minimal personal information?
Yeah, we'll take a look at what I have in the mock-ups in a second, but
okay.
But one of the things that when I said, at least at this stage, because that's, again, we want to get your feedback on what's the minimal information, is that for an Illinois WorkNet account to be created, we need first name, last name, date of birth, email, and zip code. And that's mainly because we need to, one, they have to be 13 or older to use Illinois WorkNet. And then the other is to make sure that they're not having duplicate accounts, because that would just go against what we're trying to do, and confusing to the customer. They have multiple accounts.
Do you anticipate this system creating a unique identifier? Like IWDS, when you create a customer in IWDS, it creates a unique identifier.
Yep. Each of our Illinois WorkNet accounts has a unique Illinois WorkNet number. Mm-hmm.
I mean, even if we didn't go down the path of them having an Illinois WorkNet account, this system would still create a unique identifier.
Yeah, because at least the way we are talking about this now,
Sorry.
it's no, another good question. So it's either going to sync to an existing Illinois WorkNet account, which has an ID, or it's going to create that account on the fly for them. And that would have a unique ID. So either way you look at it, they would have a unique ID.
Okay.
Mhm.
Sorry, I'm gonna stop asking questions now.
No, please don't stop asking questions. That's the whole purpose of it.
And we do have 2 questions in the chat as well.
Okay, will this be required for all partners to, or will it be required for all partners, or just available to partners to use? Just thinking out loud, but it would be great everyone to use the same referral system. Well, it's definitely going to be available for all partners to use. It's I don't have, I would say Kelly can respond if people are required to use it, but.
Thanks. I was just typing, but I'd rather unmute myself and and chat. So at this point, it will be available for all partners to use. It is possible that, it could align with policy to become a requirement. So I don't want to say that it wouldn't be a requirement, but at this point, it would just be available for all partners use. We recognize that there currently isn't a system, right? And everybody has their own system. They're investing in different systems, or even lack of technology for systems, and still have like the good old email for referrals. And so we want to build a system that's designed, for the field, for users in mind, and really to scale also beyond just WIOA program. So it encompasses support for all DCO workforce grantees. So CJO will use this, JTED, any workforce grantee and provider that is awarded DCO grant will have access to this and available for partner use. And then just to piggyback on the unique identifier, part of this too will be allow the capacity to sync to their IWDS or wherever their program of record is. So if you are serving a participant that is enrolled in a program, you can track that referral process. So I think, Teresa, you had kind of asked that question. So yeah, that's definitely something that will be available in terms of support.
Okay, so I'm gonna ask the question that nobody wants to ask. And I know that there are interagency work groups. What is the climate that you feel our other partners are going to be willing to utilize this? Because I know we have some people who like to work in some silos. And if it's not something they created within their agency, they're very hesitant. So I'm just curious what those conversations, what's your feeling for that? And I'm just going to say it out loud. In particular, IDES. What have they shared with you their feeling to use this as a partner?
So we have not rolled this out to all interagency, to the state interagency work group, just to be transparent. We do have a working group that's in place right now. The working group is focused on practices and more or less, policy versus looking at system use. So in order to have an effective system, we wanted to identify good practices, right? And so that's kind of where the conversation is currently with the working group. But we have to address a need for, for the Title I programming. And, and so we're really rolling it out and kind of working through some of the, the feedback from from our Title I staff and providers and all of our workforce grantees. And certainly we'll solicit feedback through the state interagency, working group on what they want to use. We know that Voc Rehab has their own online form, for referrals. So that's their, so we don't want to say, if another provider title has a system that, they want to accept referrals, that's a different situation, right? So I think that with anything, what we find is, you got to solicit input and buy-in. And, I think that we'll get there in due time. So right now we're still in that initial discovery stage before presenting some of this to our partners.
Well, I think the good news is, at the more local levels, I mean, we just agreed to go out and we purchased a referral system this year, and all of our partners agreed to it, and that was at the local level. So
Right.
I think that, to me, that's encouraging. I didn't know if you'd spoken, if there have been conversations at the state level.
Well, and that's why we can't say this is required at this point, right? And so I think that we want to have a system that's available for all partners to use, and we hope that local levels, because here's the thing, you're investing in a lot of other systems and it becomes very costly. And so we want to,
Oh, no, you're preaching
yeah,
to the choir. I've been at DCO to build this since I got here. So
yeah, exactly. And so we, from a savings perspective, from Title I perspective, we're like, this could be a huge cost savings to the local areas where you don't have to use those administrative costs for all of the systems that you currently invested in. But we know that there's some good systems and things that are taking place also locally. So we recognize that and acknowledge that too. So we definitely want to take all of those factors into consideration.
Again, sorry, I'm done asking questions for a while. Go ahead, Natasha.
Oh, okay. Very good. Another question Joel has is, how can we ensure the customer is referred to a particular office if a partner has multiple sites? So within the service locator, we have, where we can identify a specific office location. And so we have that built into the mock-ups to identify, I'll just kind of tell you up front before we get there, for them to default to, I think it's a 15-mile radius, and then from the address that's in the system, as well as being able to see, the address whenever you select a partner to refer them to. So good point, and we'll take a look at that in just a second. Okay, so sending referrals, excuse me. We have where we would use a select a tool where you select services from a standard list. And that's there's multiple reasons why we use a service locator, but one is because we already have a tool for identifying the various partners and the services that are offered, and it collects, location information, and that's used in a variety of ways. You can search it. And so the idea is to update that list to the standardized list that aligns with our entity management that's going on. And so then, okay, I guess here we go. And so, yes, so we would have like the search so that you can, when we have the provider, you can use like a keyword search. So if I said that I'm going to look for transportation, I can look for, CBO number 1, or I could just, take a look at the organizations that offer transportation services and that are near me or within 15 miles, and and those would be listed. So we wanted to be able to provide it with a couple of different ways to identify providers for a standard for those services. And one of the other suggestions, make sure I'm like not moving, there we go, is to allow the person that's sending a referral to send multiple referrals from one screen instead of having to go back in and doing it multiple times. Another thing that we've incorporated into the mock-up is requiring a standard customer consent when sending a referral. you'll see it here in the mock-ups. I wouldn't get too hung up on the text necessarily. It's more about the concept of how the customer consent would work. And then whenever you are creating a referral, it's going to, we can populate and print a referral on, a standardized or a general referral form. So you have a standard list. You select who you want to provide that service. You can see it on the screen. It'll create the screen so you can send referrals. It'll check to see if there's a consent, and you can populate a standard form for those for that when you're sending that referral. Are there any big buckets that I missed for that? Can you cross-reference both service and location? Right. So you could do, and what I think, I'm hoping that when we look at the mock-ups, that'll come clear. But then we would also, have a search. So if you wanted to search for transportation within 3 miles or something like that, whoever offers that service, you could do that. Okay. So in 087, IDS has sent 4,800 referrals to partners within the platform they use. Okay, but just, I assume you're showing that the partners are open to using some other systems. So good to know.
Yeah, at least in Cook County, I think a lot of it is still built around relationship building, but they have been a high user of the platform that we've been paying for and using in the Cook County area. So I don't know if that's helpful, Teresa, but we do have a little bit of data that says that, if it's the right relationship, the right platform, maybe we can, get some movement there.
And I think transparency also is helpful, right? So when you have access and you can see what's going on and you're not just making like blanket, the referral abyss and you never know what happens. So I think that, we're definitely being very mindful of that with, any sort of system build out with what access looks like and, how it can be customer centric.
So we went through sending referrals, reviewing referrals and responses. A few things that came out of our previous sessions were, one, we don't want to require the partners to log into Illinois WorkNet if they don't want to, they don't need to. The other is that to have a standard response list and to keep it as simple as possible with, but also covering the bases as to what's the status of the referral. And then, so we have a standard response list, but then also providing like a space where they can add more detailed notes. And then again, based on the information that's entered the system, to print a referral form for the customer or for your files. I'm gonna keep moving on unless other people, just feel free to stop me if you have any questions. The next major area that we had was to receive notifications. As I mentioned before, you can set to have one or more people that are responsible for receiving referral requests via email. Then the system will know when that referral has been sent. And then we have the system send out an automatic email an automatic reminder for referrals that are past due. So I think I have a question over here, but what's been mentioned in the past is that most people, or the feedback that we've received is that they usually say 2 days for somebody to respond, to 2 business days for a person to respond to a referral. So in this scenario, if it was day 3, then those that are identified as receiving the referrals will get an automatic reminder that says, you have 5 referrals that are past due. Like, these people haven't, responded to the referrals. Or, it could also say, you have 5, you need to respond to 5 referrals that are past due. So it can go either way, as far as you haven't received a response or the organization hasn't provided a response to someone else. And then the other piece that came about is an internal message system. And so, without knowing a little bit more detail about what would be needed for an internal message system, we do have case notes that are available that could be used with each of the customers. So I'm not sure like what type of information would need to be shared on like a case notes for an internal messaging system. In addition to that, I know, that we've mentioned in like the previous areas up here that you can add notes that are related specifically to a specific referral. But if you have partners that are working with, a working together with a certain person, we do have a case notes feature. Okay, so Joel had a question. Will the system allow for bulk referrals, say from IDES, RESCA shops, and then bulk response to those referrals? I'm not familiar with that. Can you provide a little bit more information?
Well, IDES has these RESCA workshops that are basically what the old sort of profiling thing. And so like in our current system that we have, I will get, 20 referrals. And then currently I have to do 20 individual email responses, assuming that they've actually referred them to the correct person. So I was just wondering if, and they're having to put them in individually as well. So I'm just wondering if there's any way that they could do, so everybody who's in this workshop, since they are all, they may be eligible as dislocated workers, that it would be a simpler process for them to just add, because they have the email list of everybody who gets invited. So then just to be able to use that as a referral list would make it very much easier for everybody.
I don't have that mocked up in the system, but what I did do is put it on our additional must-haves or like-to-haves. And I took your question out of the chat and put it on this board. So I don't have a response for that right this minute, but I don't know if
I have a quick question on
Uh-huh.
that. So is that a referral to like move forward to possibly do like an application for dislocated worker and not necessarily for a specific service? Or is
Correct.
it, okay.
Yeah. I mean, they will refer people if they come in and say, yeah, I want to go back to school, then they know what the specific service that they're looking for. But otherwise, it's just everybody who goes through there, then they will just send out this list of people that unfortunately I'm the one who gets all of them, and I have to do all the responding to them. And it would be easier for everybody if they could, because they have the list of everybody who's going to be there, and then just do a sort of a blanket referral would be a much more efficient way to go.
Kelly, I don't know if you know, are these workshops anything related to like what's happening in EBS, or are these different? workshop? Okay.
Yeah, this is different. So this is
Okay.
for, this is a program administered through IDS, and essentially they have like different indicators for individuals that are long-term unemployed. And so they hold these workshops, and then they make a referral over to Title I for Employment and Training Services, because there's different indicators that indicate that these individuals have, higher potential risk for continued long-term unemployment, and making that referral to the program.
Okay.
I think it's structured. I mean, all the referrals are taking place, but I think that that's probably something to dive a little bit deeper in, because
Mhm.
in fairness, like to the example that Joel just shared, we don't want a local area being inundated with like 40 referrals and then with the expectation that in 2 days they have to respond. And so I don't know, Dina, do you recall? I know that you guys worked to address this, and this is probably before you came back over to scale it. So we might not have the answer on this call, but I know that I think that LBS7 determined like, hey, you know what, this is a little bit different because this is a workshop. This isn't a direct individual referral. And so they kind of worked around what that might look like, just to manage expectations on that.
So this came about probably 2 years ago. It was, I believe, a directive from higher up within IDES. And Teresa, I know you've been around with all the conversations, but all the LWIs were
Hey, Sarah, you're
contacted,
really
and
breaking up.
they were asked if they could receive a list and then reach out to ask what type of services they would need. So it was kind of us working together with IDES. And oh, I'm sorry. I'm kind of in a bad area, so
It's all right, Sarah. I know what you're talking about.
I'll
So
put it
yes,
in the chat.
yeah, we do want to be able to capture those folks in our relationship with employment services, and getting those people some maybe some other services, like let's do some job coaching. Let's do, do a resume writing. Let's take a look at your resume. Do you want training? So we are working with the people who, just like Joel said, we get a list, we know who they are, and we do reach out, contact them on a pretty regular basis. Natasha, this might be a situation where if the system could allow an upload from an Excel document, might solve the issue that Joel's talking about when you get bulk referrals. I do remember those conversations.
And are your list, how you guys receive the list, different? Like, do you get an Excel list from IDS?
I think it depends on your location.
Yeah, that's kind of what I thought.
Yeah, I would say because we have our own sort of self-made referral system, and they're all just done individual things, and then how ours works is that somebody puts it in the system, does a referral, and then it creates this thing, and it says an email to my email address.
Yeah.
And so then and we have some other issues with ours that I got to fix, but I mean that's the one that is just the most time consuming, because if it's a one-off here or one-off there, that's one thing, but then if all of a sudden on a Friday afternoon at 4 o'clock you got 35 of these coming through, or by the time they get to them it's Monday, and it's also it's very time consuming for the IDES person to have to put them in individually, and so it just some way to make something like that much more efficient, it would be ideal.
Do you have like an example of what you get, you could like take out all the PII and like just send us an Excel sheet with the headers that they send you, just so we can kind of see what all you're passing back and forth in that export? Or, or I guess you say they're doing them individually.
Yes, they're individual emails that come, and
Okay. Could you send like an example of one of those so we can kind of see like what are they sending? You can take out like the PII, like you can put first name, last name. We don't need to see any of that, but I'd love to see the kind of data that they're passing as part of that for you to reach out.
well,
A
all
lot-
it is the name,
Yeah.
their contact information, and then there's a thing on there that says reason for, referral, and in that thing they just type in RESEA. So
Okay.
I know that that's
Oh.
what it is.
And what do you do when you get that? Do you have to then you put it into your system or
No, generally what I do is wait till I get a good amount of them, and then I go through each individual email and pull out each individual email address, and then do a bulk email using blind carbon, and just send it the same note out to everybody. And because the thing is that, like I said, we before we have several offices, so
Mhm.
I don't know exactly which office to refer all of them to. And generally there's 4 or 5 that aren't even in our area that I have to sort of parse those out and figure out, if I want to send them to another area. So, but then, yeah, so that's basically how we've been handling that. And it's, it'd be nice if there was something better.
Mhm.
But I
Okay.
mean, as far as the information that gets, there's very minimal. It's just name, address, um, phone number, and email, and
Okay.
then what the reason for the referral,
You
and then
know,
who sent the referral.
yeah. Bill, what we could do for Olivia is talk to our counterparts at IDES and say, how are you? I mean, is there a list you could send us rather than individual emails, and see, are they generating this out of a system? I don't know.
Right.
So
Or-
let me ask my counterparts here how they gather that information, and how, because I just get a Word document that's a printout. We don't even get it emailed to us. So everybody's a little bit different, but yeah, and Sarah, yeah, she's getting a copy of the list from LBA 20. So let me ask some questions, and then I can give you a better educated
Okay.
guess.
One of the things we could do is provide an upload form so they're not sharing PII over any
Right.
other forms. And even if they put their name, address, phone number, email, I mean, if they could just toss in their date of birth, we can see, upload them, check see if they're already in the system or not. So,
Yeah.
Yeah,
And
like I said, I think we all get it in a different format, but depending upon who we're working with. So we certainly could, talk to them and get something a little bit more standardized. I think they'd be willing to do that.
when you email them after you get the referral, are you simply just inviting them to come in to see if they're eligible for the dislocated worker program? Or when you email out, what is your objective there?
What gets sent to them is just saying, we received your name from IDES that you may be interested in services. And then I actually attach a PDF of a 1-page flyer. And then I say, to please call the closest office, the one that's closest to you, for your convenience. And that's basically it for those. For if it's another type of referral where it's a specific service, then
Right.
we contact them. But for this, that's how I've handled those.
Okay. Because that's what I was wondering, Natasha, is like, is there almost a way they can bulk upload something into the service finder and we could auto generate an email with information on how they can connect with their the closest local area to see
yeah,
if they're eligible for service?
yeah, I mean, I would, I think I would still do it like through the referral system, then they can
Mhm.
count and see who's received it and they have all the information there. But Yes, I would agree
Yeah.
that we can respond with whoever's been identified as accepting referrals, in the area, which would be the
'Cause
AJCs and whoever.
from your guys' perspective, is there a necessary reason for there to be a step in there for you guys? Or should IDES be able to go in there and bulk upload something that it automatically agreed upon by the OEAs sends off to help connect them?
Well, now you're being efficient.
Mm-hmm.
Yeah, that would be ideal. If they did a bulk upload and it pushed a referral to Title I.
And then they could just have this RESEA
Mm-hmm.
flag, and then you could pull it from your reports or dashboard or whatever.
That would be ideal, yes. I agree with Teresa on that.
Cool.
Okay, can we go back to one thing, Natasha?
Yep.
You talked about potential, let's go back to the beginning. The use of case notes for like an internal messaging system. This is kind of going to be critical. So here's my question. If let's say I have a client that comes in and I know that they really need to go to DHS and get on some SNAP. And they're not willing or uncomfortable making that step themselves. So I'm going to send a referral to DHS. And I said, I want you to contact this person. I think they really need services. Will this system tell me the outcome? And I think that's what the internal message system request is for. So
Gotcha.
say Amy Shields over at DHS shoots me an instant message. Hey, Teresa, I got this person. Is there something specific you need me to talk to them about? And maybe it should be kind of outside. Again, personally identifiable information. A lot of times she'll just pick up the phone and call. But the system that we're using now shows some resolution.
Yep.
Like I can go in and I can run a report and say, hey, I know Amy called this person within 2 days. Because she has updated, notes on that particular client. But there might be some things that may need to go back and forth internally. And maybe we don't use this system just for personally identifiable information. Maybe we do pick up the phone. But a lot of times things occur either on the phone or, emails. Hey, what does this person really want? And so if we had something that would say, we could sort of have some of those conversations about a client or a participant or whatever we're calling member of the public that might need services. I think that is where the internal messaging is coming into play from the local workforce area perspective.
Okay, that is good to know. Yeah. So, and I think we've addressed most of that, but there more likely is like a gap that maybe just kind of like the bulk upload, like where you guys would have some areas that we can improve on what we've proposed here. So I'm just gonna I know we're running out of time, but I wanted to kind of at least start diving into some of these because we talked about a lot of requirements, which is good. And the idea that we would have a dashboard so you could see how many completed, in progress, how many are behind. It doesn't necessarily mean that these have to be what is on the screen, but just to kind of give you an example of like, this is your dashboard, your landing page. You have some simplified views. You can look at more of a list view, so you can see what the status is, where they are, whatever is important for you guys. But then you can also do like create a referral. So let me just show you some of these real quick. So we're going to go down here to select the create a referral button. We're going to say, is the customer already in the system? If we say, nope, they're not, let me zoom in here for you. You can see I have in here first name, last name, date of birth, email. I went ahead and put veteran status up here because it seemed like it was kept a reoccurring thing. And then, you know, your organization. So, but let's say you have like, I think Joel was even saying like 3 different locations, you know, am I representing north, south, east, west, whatever, you know, you're, you know, am I in Lincoln today or am I in Springfield? I don't know. So, you can select your organization if you're have multiple. Some optional information we have is like for your phone number, street address, city. Again, just because we're trying to minimize that initial PII. I don't know what you guys think about that, but if the customer is in Illinois WorkNet, then it'll sync to an existing account. If they don't have an account, it'll create the account on the fly. If there's a conflict because it's the Natasha Telger, but you know, the date of birth is totally different and it can't make, or there's multiple emails or, you know, whatever reason, they'll tell you to contact Illinois WorkNet and we can get that resolved, just because we just don't want people to have, you know, conflicting information or, you know, 2 accounts where not everything's not centralized. And then once that's set up, then we can go ahead and create the referral. But to get your initial reactions on this minimal information that's being collected when you add a customer, is that, let me just scooch in here in case you can't see it very well.
Yeah, I agree. That's all we need.
I would add, please put in county, because I know since where LWAs are divided up into counties, that we know, because like I said, I'll get some that are out of our area, or I'll see a town, I'm like, oh, what the heck county is that? Like, so it would make life easier. Another question I had is there a way then to sort of forward a referral? So let's say I get a referral for my services, and then I realize, oh, this person also needs this service. Then how does that sort of get forwarded on to another partner?
So that's a very good question. So I hadn't thought of it in like the forwarding aspect of it. I mean, initially my thought is like, oh, well, you know, if you're accepting the referral, then you would create a referral for them, you know what I mean, for this other organization. But then that doesn't also necessarily include, you know, the original sender that, I don't know, what is your thoughts on what would your request be, or how would that work?
Well, I mean, originally I thought of it mainly in terms of if someone made a mistaken referral by, you know, geographic area, then how would I forward it on? But also then, you know, as when someone gets referred to and then you talk to them, then, you know, you want to make another referral, but I wouldn't want to have to go in and recreate the whole thing. If we could just get the original referral and then add, it's sort of like in iWids adding an episode, you know, you basically just adding onto the referral chain.
I really like that idea, Joel, because it lets you follow that customer.
I'm going to zoom out here real quick and throw it over here in our idea. I'll throw that there for now. But that's a good idea. I just have to, we'll just have to think through that a little bit, you know. So we will do that.
And I promise that's my last one.
No, please, you've had lots of good feedback. So, you know, thanks. So then let's see here. So then the idea is that, you'd add the customer and then you would select from the list and then move on into the referral. Now, if you were already just adding, like you were just searching, let me think. So if you were searching for a customer, you could say, I need to send one to David. So you could put like first name, last name, or both, or search by email, and you could see the David, and you pick which David it is, select, and then, so you have two examples here. If the customer, ideally, really what you would do is go in here, search for your customer. If you don't see your customer, then you would go over and add them to the system. That would be the more ideal way to, for that workflow. But so far, are we, any other comments about this initial, other than the upload version? Any other thoughts about this adding a customer or searching for a customer to create a referral?
So I'm wondering, Joel, if the searching for a customer might be your forward. Well, let me ask you this, Natasha, if you pull up a customer, can you see that there were other referrals made?
See, that's
Or
where I
do-
get into what is allowed, like what,
Okay. I know.
with the consent forms, you know what I mean? Like how far did that all extend out?
Because this is gonna go beyond. I see what you're saying. I didn't think that through. So, and here's why I really like what Joel brought up. We have partners that are not a part of our core or required partners. I have a partnership with Transitions Mental Health. They're not part of our one stop, but I want to let them know if I have someone who comes in here that may need their services. We also work pretty closely with Iowa. And if we get a client who comes in here who's worked for an Illinois company but lives in Iowa, may need some training, I want to make sure my counterparts in Iowa know that. So I'd love to be, and not that I'm going to get them set up in Illinois worknet, because that would be a whole issue. But, I would like to be able to have enough of this information that I could send this outside to other nonprofits, other social service agencies. I mean, I think that we've got a limited enough information. Is there a way I can take a referral and email it to someone who's not set up in this system? I'm not saying I want to do
Yes.
it. I just want you to think about, would it be possible?
I was gonna put border state example, or not border, or I guess so.
Border state, but that's perfect. And it probably is the simplest example to give.
So
By the way,
Teresa, in that example that you gave for the partner, are they are they tied to entity management in Illinois in IWDS or no? No, because they're just a local partner that you're working with. Okay. Because this is tied to entity management and service finder. So in situations where neither of those two exist.
And in particular, anybody in Iowa is not going to be in this system. So
for the service finder, as a partner providing services to your customers, though, would they be willing to be privately in the service finder so that you could
I think
refer?
so. I think so. I for those entities in the state of Illinois, absolutely. I think that's kind of a no-brainer for them. We're walking on eggshells when we get to a different state. because they have their own set of rules and regulations. And my best guess is that they will not be allowed.
They wouldn't be allowed to add themselves to the service finder.
I don't know that for sure, but I'm gonna guess probably not. So I'm just looking for, opportunity, maybe, and it's, and we're doing fine right now, emailing information back and forth, because again, it's all about relationships. But I'd love to find a better way to track it and keep abreast of it. So if I can, right now, I don't have an easy way to track the emails that we're sending back and forth to our counterparts in Iowa, other than creating a spreadsheet. But if I could take and put it in this system and at least track it through the system, that my intention is to send this to, someone in Iowa. My board would love to know that information. I'm looking for a one-stop shop. One place, one report. So.
Okay. I think that's
we can, Natasha, we can just put it on maybe a wish list somewhere later on down the road.
Sarah asked, I'm sorry if I missed this, but would the referral system require customers to sign their consent to share basic information?
It is further down into our mockups. So it's just a spoiler alert. It's a verbal consent was what we have in the mockups right now. So they're working with, Teresa, then Teresa said, hey, Natasha said that it was okay, and then mark it in the system that way.
It's what we're doing now.
So
in the referral system we have.
I think we are, I want to be mindful of your time. I think we are, a little bit over time. Can we go ahead and set up a next session to review, or like find a time that works good?
We can do that now, or I can connect with Sarah from our team and see if she can get an email out so we can find a time that would work for the group. I know several folks had to drop off.
Okay. Yeah, we'll just have Sarah like send out an email and then find a time that works best for everybody. So
Perfect.
well, thank you very much. This has been very, very helpful. I really appreciate your feedback. So
Thanks all.
all kinds of ideas right away. All right. Thanks.
Thank you.
Thanks.